don't forget to think about the complications, because the complications of the biostimulator that you have to think about is would be hypersensitivity of the volume of the particles, and for the last thing that we don't want to get is the granuloma formations that we have to handle, how to handle with these conditions. Okay, this picture that you see, this is a complex of under eye deformity. You may see in the outermost is the skin laxity. This is the excess skin also, and there is volume loss, there is a bone resorb, and there is a hyperpigment. Many problems in the under eyes around this area, and this is complex structure, and also is very delicate area that I have to keep in mind. So nowadays we use only the volume augmentations. Most of it they use the HA to collect the volume augmentation, and you may see the result. This is not can create the new skin. That's why that I call that eye wall strengthening. If you got the strengthening of skin of eye wall, it may cover the under eyes contents, right? So biostimulator, it would be the effective to help us to reverse skin aging to become the young skin. This is a picture to show you. Have in the white line, it is a patient to show in the lumps creation in the long-term HA injection for collect under eye for 1 year after HA collection. If you have experience to collect the under eye problem with HA, I'm surely that you have been meet this situation. So we're looking forward to find another new way to collect under eye. That's why biostimulator would be the choice, treatment of choice to create the new skin, new collagen, and support the weakness structure and long-term produce collagen production. And let us review about the infraorbital deformities. It has been changed in all layers. Don't focus to collect only in the volume augmentation. You have to collect every layer of the structure. You may see every layer have been changed to become thinner and laxity, even in the bone. Especially in the bone has been thinner and widening. That's why orbital bone widening, they cannot support the content inside that may show the under eye pop up that you see the bulgings of eye bag. That's may see. Okay, and what inside in the sagittal part, the ligament may be weakness also. It will pop up of suborbital fat. It starts from the orbital septum has been stacking and prolapse of the fat. Also, OO muscle has been weakening. It cannot support the infraorbital eye anymore. And medial cheek fat has been descending. So they create the teardrop deformities. Okay, how to deal with the other eye problems? You have to collect in every modalities of the problem. So if the volume depressions, you have to augment the volume. If you see the eye bag, you have to remove the eye bag. And if the skin is excess, you have to excision some skin, or you may create the skin tightenings. It can be the answer of the colleagues or the deformities. What about the role of biostimulator in infraorbital area? What is the biostimulator? You have to know what is the biostimulator and what is the mechanism of actions. Normally, we create the minute injury. There is the involved of wound healing, but for the biostimulator, there is another mechanism is the foreign body reactions that you have to know. Is not only wound healing, there is long-term inflammations from the foreign body rotation. So that you have to know deeply understand for what you should to use in the biostimulator and what is the biostimulator of choice when you selection to use in the under eye periorbital area. It would be very delicate and the polymer it would be allowed to use in ID in the underdermal field because in our market available is there is many type of polymer, so you have to deeply understand and wisely to choose it and how to use in under eye in the publication review. Okay, what is the biostimulator? This is is organic substance that can stimulate the physiologic tissue to synthesize the collagen and extracellular matrix. The mechanism involved, that is, they create the wound healing. The wound healing would be start with hemostasis, inflammations, proliferations, and remodeling. But it's not finished in biostimulator. They still have foreign body reactions. And in the cellular, why the biostimulator can create the collagen? In the cell level, their stimulations the macrophage type 2 stimulation adipose-derived stem cell to create the fibroblasts. That fibroblasts will create the collagen. And another way, they still detections the biostimulator can stimulate the EVGL that can produce TGF-beta. This is a marker of collagen production. And when you use the biostimulator, it means that you will gradually volume augmentation, which will improve your quality of skin in the later. Okay, this is a picture to show you. In the upper is to show the wound healing mechanism, and in the lower is show the foreign body reaction. It's almost the same, but there is some still for foreign body to long-term stimulation and for long-lasting collagen productions. This is the paper that's to confirm you there is the mechanism that the polymer PDLLA. That means in available in our market is Juvelook and Estifil. PDLLA will pass to signal to stimulations macrophage type 2 and produce the and stimulations adipose-derived stem cell and promote the collagen productions. Another one is to confirm that PDLLA will not only productions by stimulations the macrophage, they will stimulations the EVGL to produce TGF beta. That is a key signal to produce skin rejuvenations. This is the biostimulator in our market. One type is a PLLA that you may know is Scouter. PDLLA you may know is the Juvelook Lenesner, and another one is the Esifil. PCL is Goli, PDO is Alcohol, and CARHA is a latest. Okay. And what is the difference inside? Everything you have to focus in the properties biodegradable, what the degradable for the metabolisms, longevity, and hypersensitivity. But all of them have been bioabsorbable and biocompatible and also biodegradable. Okay. And And now, in only under eye area, we focus only the skin rejuvenations that we provide only PDLLA and PDO. This would be better that you use in the superficial layer, okay? And this is allowed to do in the ID injections. Okay. When we compare in the PDLLA group, this is the Juvelook, Lenesner, and Esabella. It's quite the same in the PDLLA, but difference in the complementary is Juvelook is a HA, but Esabella is CNC. And there is some difference in inner side. There is in Juvelook is a polarized lenticular structure to be a homophore to long-term stimulations, while in the Esabella is empty inside. Okay. For the PDLLA compared with PDO, it's quite different in their compositions. Is the PDLLA, but this one is PDO, and the complementary is the HA and CMC. And both of these provide in two products. In one is superficial, and another one is for the in the dermis part. And PDO is last about 6 months. PDLA is last about a year. So this study, in my clinical study, I use the Juvelook to study in under eye that I will talk later. Okay, for the review in the biosimulator for infraorbital area. Before we go to the clinical study, let me remind you for the teardrop deformities. Most of it they define on the teardrop. If in the mind stage, that will create their volume loss in the inner canthus, not beyond to the midline. But in the moderate or grade 2, there is extension to the midlines and involved with the deep fat depressions. And in the grade 3, is extend over under eyes and almost involved in the fat descendings and skin laxity also. And this is another gradings of the under eye deformity that we focus more in the depth of the teardrop and hyperpigment and descendings of the fat and lower eye lightitis. This is the scale in the Fitzpatrick when you want to study more in the gradings. But in our work field, we do in the clinical. It's very used. They call ABL classification score. A it means atrophy, and B is mean bulgings. L is mean laxity. So you will see these patients. This is atrophy all along the under eye, maybe grade 3. And bulgings along under eye is eye bag, and fat descent would be about grade 3. And also the laxity of the skin is the lower eyelid laxity, and cheek laxity is L3. And this is a clinical test that you will evaluate your patient first before you do the procedure. This is a snap test to evaluate the skin qualities and elastic lip foil. And this is a lip test. You put in the skin to the cheekbone or zygomatic bone. That means show the skin is laxity. And push test is the simultaneous to volume augmentation is mean that your under eye problem has been volume loss. So it is the way that you define the problem of your under eye, and wisely to use the way to correct that. And this is the paper has been studied in the Taiwan in the patients, about 100 patients, has been studied in 2019 and studied continuously. They do the patient, any patients who has teardrop deformities. They grade in grade 1, mixed with they study with the SFU, and mixed is sterile water in 7 cc with 1 cc lidocaine. And grade 2 and grade 3 is mixed with the more concentrations in about 4 cc and 1 cc of lidocaine. And they injections in the lateral canthus, okay, 1 centimeter and 1 lower in the lateral canthus in fan shape, 2 cc for each, and study for 100 subjects. Okay, this is in the plane of ID plane, under the mist, but above OO muscle. Okay, and this is the patients of the research. The man's come with, and this is the picture before and after, immediate after, in the right side, in the left side, and 9 months follow-up in TTD grade 3, right? And with sterile water, 3 cc with 1 cc lidocaine, and 2 cc for each. They do only 2 sessions, 2 months apart. This is the result in 9 months follow-up. Okay. It's more natural, and there's no lump. Okay, and this one, TDD migraine, they mix with 7 cc dilutions in 1 session, 2 cc for each, and 8 month follow-up. This is a wonderful result you will see. Okay, next, not only the PDLLA, this is the alternative periorbital treatment option by using CAHA. CAHA that you know to use in the deep part, in the subcutaneous part. But this paper, they study in 12 patients. They study in the deep part, in the along ORL, in the, here, you may see, in the deep part of CAHA. The injection in the droplet along the ORL. But they do another one, very diluted wash to injection under skin together. They work in 2 layers. This is the dilutions. 1 cc of CAHA mixed with 0.1 cc of CAHA mixed with 0.4 cc of lidocaine. And there is a very dilute CAHA solutions and treat in the subdermal plane along above the muscle line. This is the critical result, long-term follow-up in 18 months. You may see in the pre-treatment and 1/2 of the year, the skin volume decreases, and skin quality and hyperpigment has improved. So that means that biostimulator that will create and collect in all level of the deformities of this one. And this is my critical study that I have been choose the Juvelook to study PDLLA. I study in 5 subjects, and my 2 moderate grade of TTD and 1 cc for each, and monthly for 3 months. Before I take a picture before and after, and 1 day follow up, 2 weeks, 4 weeks, 6 weeks, and 8 weeks, and lasting for a year. Okay, and the positions you can do in the supine or upright is fine. I will show you in the video. And anesthetic, this is very thin. So numbness cream is fine, or you may use in the injection is also. The entry point is the palpable part. You may use in the lateral canthus, 1 cc above and 1 cc below. Or you may approach in the V lines, connections of nasojugal and teardrop and palpable molecule. Intersection of lateral canthus and teardrop. The plane of palpable is the mid, and orbital part you may be do in the subdermal. Oh, no, it's subcutaneous plane. Okay? Okay. And this is to show the injection site. Okay. Uh, this is a injection site picture, and there is another plan that I will show you. This is a pre-cytomatic space that you can injection below the OO muscle. This is my clinical study in TDD grade 2 and before and after in the 4 weeks and 8 weeks. Okay, and this is a before, immediate after, and 1 day after. You may see that it's not much swelling. Okay, this is a before, after, and 2 weeks. The skin is much better in the lateral side. This is a video I show you some. First, we don't have time. You may define the side that you prefer to collect in the V line and in the lateral side. Okay, this is another patches that we collect in the migraines also. Okay, you may see the picture is a little bit issue, and this is in the supine area. Okay, you may see you may hear the situations in both areas. Okay, another one patients. Okay. Okay, in this case, you may see there's a lumping for HA in the last, but I didn't dissolve it, and I collect with the biostimulator, and this is much improved and wonderful result in 1 year follow-up. Okay, and this year. Okay, last we'll talk about little in the complications that you have to cope in. One, because you leave the foreign body. The things that we afraid that hypersensitivity to it and prolong the provide and will create the granuloma in the last. Okay, swellings and lumpings and nodule inflammations, bruise, hematoma, and intermittent. Okay, how to deal with the complications. If the swelling is large, you may use the oral steroid. If the over collect, you may use interlesional normal saline to dilute it, or interlesional steroid. But the foreign body become the nodule. Is it non-inflamed or inflammations? Is it non-inflamed interlesional? High dose for a week, for 3 to 6 weeks, and for high dose, you may use a systemic steroid. And periorbital granuloma is at the end of, it's really have to keep in mind late onset of body reactions, of foreign body reactions. This is develop the foreign body reactions after 18 months. It's not mean that you injection today and 18 months may be developed. Okay, okay, and how to treat the granuloma is excision, so you have to keep in mind. And also develop the sudden dryness has been publication in 2023 already, and will aggravations or underlying diseases like rosacea has been come back. So last we'll take home message for you. Injectable biostimulator as skin booster. It improves skin qualities and volume gradually, not immediately. Actions in overall improvement, not size specifics. All injection type made for vascular accident. So you keep in mind we to get injection and gentle injection still required. This is unchanged mind. It's mean biodegradable, biocompatibilities. There is no antidote like hyaluronidase. Allergic reactions, autoimmune should be beware. And nodule, you will collect with the steroid, systemic, and interlesional. But the ends of the granuloma, you should use the excisions. And how to avoid it, you have to select in the good candidate and asking about the allergic reactions and more dilute ends, stay in the deep and minimal